This is our annual healthcare conference, and we pulled together all interested entities within the healthcare delivery and insurance system to talk about, and never has it been more timely, both on the federal and state level. Federal law has changed dramatically, affecting all of us nationwide going forward. Of course, all of that is dependent on future outcomes in the judicial system and efforts at the congressional level to modify or even repeal what was done last year. On the state level, we're revamping our Medicaid system, going from the old FIFA service system to a managed care model that almost every other state has already done. We are benefiting from the fact that we can look at what other states have done right and what they've done wrong and avoid those mistakes. So at the same time that we're having a massive national overhaul of our healthcare system, we're also having a huge overhaul, massive overhaul of our state Medicaid system, which is a large part of the Louisiana healthcare delivery process.
We have brought together people from all over the state. Well over 500, almost 600 people will be here today to learn the latest and greatest about the healthcare delivery system, not just in our state, but nationally. And what we've done is we've brought together people who represent providers, people who represent consumers, people who represent payors themselves, as it were, businesses that are actually financing the cost of health care, with individuals and government representatives that do so as well, with the delivery system all here to talk about how we are doing in terms of implementing national health care reform and Louisiana health care reform.
Really what we're talking about today is reinventing our state's healthcare system. We have a number of items in the portfolio, like our coordinated care networks, which brings managed care to Medicaid. We're reinventing the way we do behavioral health for Medicaid enrollees, those that are at-risk kids. And we also have a very aggressive agenda on health information technology. We want to deliver technologies to our physicians and hospitals to make better patient care, better patient safety, eliminate duplication, and increase efficiency.
Basic message is just making sure people understand what's going to happen with healthcare reform. There are some immediate reforms that are already going into place. There are things coming up in 2014 that will really change the marketplace, especially the individual market. For a state like Louisiana, there's going to be some significant changes in way policies are rated, who's accessible to policies, how they're pooled. I just want to make sure they understand the mechanics of what's going to happen to the insurance marketplace.
What kind of a bottom line do you see for the average consumer?
Well, it kind of depends on where you sit now. If you're a young, healthy person, you're going to see probably what you would see as not positive changes, because the way the market's going to work is all the rates are going to be condensed. But if you're somebody who has a difficulty finding coverage, affording coverage, there's going to be a significant improvement in your ability to get coverage and afford it.
We're at a collision point in our healthcare system. The costs have gone up so much, and we struggle to be able to provide the care necessary for the population that has problems. We know that we're 49th in the nation in terms of our state's health outcomes. We have enormous amount of progress that we need to make on health outcomes. We have chronic disease at a very high rate, obesity, diabetes, cardiovascular disease, and we're not getting the outcomes that we need from our system today. We have to change what we ask from our system, change the way we pay for it, and get better health outcomes as a product.
We have a significant piece of legislation that we're challenging in court, that we're not certain whether it's going to be upheld by the Supreme Court, but we have a responsibility to implement those things that are statutorily and legally required for us to do, and the only way we can do it is by working together. So the more we're involved together, the more I learn from the people at this conference, the better off the product is going to be.
In this legislation that the Congress has passed, They have one version of exchange, which is really to run a federal program and federal subsidies. But I think it's important for states to understand that they can do their own thing, do it separately, do it differently, and really do what health insurance exchanges were designed to do, which is to provide employers and their workers with a new alternative, a defined contribution alternative, if you will, for health benefits, so that people have more choice and more flexibility and more businesses are able to offer coverage.
What kind of an impact is that going to have, do you think?
Well, there are a number of interesting impacts to moving, or at least putting the option of defined contribution on the table for employers. First of all, it makes it easier for a lot of those small businesses that currently don't offer coverage because it's difficult to arrange group coverage, that sort of one size fits all. It gives them a new option. It gives them the ability to say, look, here's a place where you can go and get coverage. Here's the amount of money I can contribute tax-free. You put in what you can, and you can buy coverage. It gives them the ability to prorate contributions to part-time workers, so that part-time workers could put that together with some other funds, like maybe they have another job, maybe their spouse does, to buy coverage. Those are the people who are often left out in the market today. That's the idea behind doing defined contribution, and the exchange is really a mechanism to facilitate that. It's like a human resources department that matches all the dollars and the people.
Well, I hope that these folks, 600 of them, that are in the system, working day in and day out, in hospitals, in agencies, in brokerage firms, and all forms of the healthcare delivery system and insurance system, will be better informed, better able to share with their colleagues and their clients, their patients, etc., with detailed information, the pros and cons of what's being proposed on the federal and state level.
Take the initiative here. You don't have to wait in the state for whatever is handed down in Washington. You can actually take the initiative to design better reforms that work in your state, tailored to your state. And Louisiana has its own issues, just like every other state does. And while the federal reforms are very prescriptive, there is still a lot of room for states to do their own thing separate from the federal reforms, and really, I think, show the way for this Congress and the next Congress to redo the federal law in a better and more sensible fashion.
We have a very vibrant state with a lot of creativity, with good ideas. And if we can put partisan politics aside and get to the root of the causes that we have in this state that we need to be focused upon, whether it's our health outcome status, whether it's obesity, whether it's lack of access to insurance, whether it's employment or education, all of those pieces need to come together to address what we think will be something very important to talk about today, which is the delivery of health care that is affordable and accessible with better outcomes. So I think that if people leave here knowing that we can get along, we just need to open our minds and listen to each other's perspectives on this subject, because in the end, there's so much that we agree upon.
If there are any questions or concerns as a result of your coverage of what we're doing here today, I'd welcome their call to us at the department, 800-259-5300, or our website, ldi.la.gov.